Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. On today's episode of the Essence of Health Tea Time Podcast, I have a special guest, Dr. Margaret Towolawi. Dr. Towolawi is a double board certified physician with over 15 years of clinical experience in family medicine and lifestyle medicine, with a passion to help people live healthier and longer lives by equipping them with knowledge to take charge of their health. She is a published author and speaker, leading workshops and webinars for children, teens, and adults. She is the founder and medical director of Nurture Well Center and aesthetic practice SkinStat MD, where she has her own physician-formulated and curated skincare and supplement line. Dr. Towolawi works with individuals, groups, and organizations and has a passion for working with marginalized communities to empower them to advocate for their health using the 6 pillars of lifestyle medicine. Welcome to the show, Dr. Towolawi.
Thank you, Dr. Shayla, for having me on. It's a pleasure to be on with you.
Yeah, happy to have you, Dr. Margaret. So, Dr. Margaret, tell us your story. What led you to consuming a plant-based way of eating for yourself and even inspired you to write your children's book, 𝐋𝐢𝐭𝐭𝐥𝐞 and 𝐋𝐨𝐯𝐞𝐫𝐬w Kitchen?
So I started my plant-based journey, goodness gracious, over 25 years ago. So I was about 15 years old. And back then, you remember the magazine, Newsweek magazine?
Yeah.
Yes, my parents were getting that up until Newsweek stopped doing their print. And I used to love reading those articles. And I remember very clearly they had a article or headline about avian flu.
I remember when that was like a big thing in the news. Yeah.
Right. I'm sorry. Exactly. That was not the first one. That was the first one was the mad cow disease one. Okay. So I remember reading about mad cow disease, and I'm thinking, okay, there's this, if we eat this beef, we can get this mad cow. So why not just eat the beef? So that was my first thing. First, I cut off eating beef. I already never really liked pork. And then the avian flu came out a couple years after that, and I cut out chicken. So by the time I went off to college, I was pretty much a pescatarian, so consuming seafood. But at that time in college, fish was like a luxury. So I rarely got to eat fish. So I was pretty much vegetarian, if you will, through college and after college. And it was only in the past 5-6 years that I became 100% plant-based as I really started to learn about the health benefits and even the issues with dairy and it being very pro-inflammatory. So yeah, so it all started with me being a little nerd, reading a lot and consuming all the articles about foodborne related illnesses.
Right.
That's what kind of got
I
me.
love that because it's like even before you were a doctor, you were like, nope, I know I don't want that.
No. To me, just 2 + 2 = 4. Like I just
exactly.
Right. And then the book aspect came into play. After having thousands of patient encounters with people, young and old, a common theme I saw was a lot of people just didn't know how to eat healthy, right? And my thought was, if we can get the kids at a young age understand why we want to eat certain foods consistently to improve our health, that would be golden. So I came out with the book, I Am in 𝐋𝐢𝐭𝐭𝐥𝐞 Kitchen, a kid's guide to plant-based nutrition from A to Z. I'm just there we go. In the hopes.
Yeah, we're going to get the link to that in the show notes, so listeners look out for it because it is beautiful.
Thank you. And if you get it from my direct website, I will sign it to you and personalize it. That's the one thing I like to do too. But this book is really my love letter to my patient community, to the plant-based community, and just to anybody who wants to eat healthier. You don't even have to be 100% plant-based to consume all the goodness in the book, if you will. I just want kids to be informed so they can make the choices that they want to make for themselves as adults and not just say, oh, I'm eating this because I have to. They can understand the why.
Yeah, I love that. And, being a mom, and often what I even hear from other patients who are moms is that, we make a lot of our health decisions for ourselves because it's like, well, I want to be healthy for my kids, but then even taking it a step further in wanting our children to be their healthiest. So let us know, give us, your thoughts about plant-based nutrition in children and those health benefits and development benefits that they can get from a plant-based way of eating.
Yeah, great question. A lot of people who, think that plant-based eating is not the best for kids, that they're going to grow and not optimally. That's just not true. When we look at the data has shown maybe at first they have a little bit slower acceleration with growth, but over time they catch up, if not are often, the same height as their peers, and not even taller at times. But the biggest thing I tell people is if you can get your kids to adopt these healthy habits and get their taste buds trained to like these foods, over time they tend to consume less sodium. And we know the link to sodium and high blood pressure, consume less saturated fats, and that's tied to risk of high cholesterol and then heart attack and stroke, right? So their taste preference will change, right? They're likely to develop certain chronic diseases are decreased as well, right? So that's a lot of the buy-in I get people to think about at first, like thinking about their kids and their decreased likelihood to get certain diseases that we all know somebody who's affected by a heart attack or stroke and things like
Right.
that. So try to make that personal connection.
Right. Yeah, yeah, that's so true. Even with children of color, we see a lot of children who may have eczema or these, kind of skin conditions. And I know for me, one of the first thing I tell parents, cut some of that dairy from their diet because that dairy can be inflammatory producing and can contribute to those eczema flares. And so even, when parents just see that change, it helps to get them on board too. And then they know they're giving their child that extra benefit to not have to suffer so much with that condition too.
Right. And a lot of it is misinformation. We're sold that dairy is best. And the billion-dollar milk industry, you go to your pediatrician's office and you have how many cups of milk are they,
Right.
taking
Yep.
a day, right? So the
Mhm.
book really helps to, I think, demystify some of that. I talk about how calcium is so important and you don't need to just get it from milk. It's in foods like your dark leafy greens, kale, bok choy, just name a few things, right?
Yeah.
So parents always walk away like, oh, I didn't know that. And they can think about all the rainbow, not just what we've been told and taught for such a long time. So
Right, right. Yeah, and that's great. And so with parents, so another thing with children, we have these picky eaters. Sometimes they only want to eat this or that. So how can parents ensure that their children are receiving an adequate amount of protein, fat, and those other essential nutrients on a plant-based diet?
yeah, so first thing I tell people is hopefully your doctor feels confident to give you an idea of what the typical kid should be eating at their age group, regardless if they're plant-based 100% of the time or not. You should have a set idea. And that's the first point, right? So you kind of know where you're trying to strive to. And then, if, for example, your kid doesn't like to eat, I don't know, tofu, right? They can still get those sources of good protein from beans, right? So they
Right.
may just eat a certain food all the time for a certain season. I tell people that's okay. For example, my youngest, she has certain foods that she just hates and her brother will love. And at first I would get annoyed, like, oh, why? But then if I change how I prepare it or have her help me make it or put it in a smoothie, I've made
Yeah.
bean smoothies. And she'll say, I
Oh,
don't
yeah.
eat. I made black bean smoothies and she
Mhm.
doesn't have an idea, right? So
Yep.
getting creative is a good way to get to those goals. But first, knowing the ideal amount for the age group that you're dealing with. If it's a teen, because teens need certain more amounts of iron, especially if it's a menstruating woman or girl, I should say, than a younger kid does, right? So kind of knowing where you need to get to is the first step. And then working with the foods they like, and then trying to, as a family, shop together and get excited about cooking together. And that gets more buy-in too.
Yeah, and I'm glad you said that too about working with what they like, because a lot of times we'll feel the need to give them all this variety of stuff. But if you have a picky kid and they're like, nope, I'm not eating that, And so, but if you find that one thing they like, just give it to them, especially if you know that it's packed with nutrition. And then the smoothies, we definitely do the secret smoothies in my house.
Yeah, I
Because
like
my youngest too is something about those youngest kids. He's a picky little eater, but he loves a smoothie. And so we just toss a bit of everything in that smoothie and he'll slurp it up.
and make it work,
Mhm.
right?
If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to 𝐸𝐬𝐢𝐻coaching.com to learn more. The essence of health is in you.
Another thing when it comes to picky eaters and even, incorporating some of those tips, I'm sure, within your book, that's the great thing about it because they can see children doing these things. And that's helpful too for those picky eaters to see what other kids are doing. And then even something I did, I know when my kids were little, is incorporating them. So like when we make the smoothies, I let them, put some of the fruits and stuff in the blender. And then I throw my little secret stuff in there, that I know they need.
Right. Right.
So what other tips do you usually share for those picky eaters?
Yeah. So, I mentioned going to the grocery store and having them shop with you, but specifically when I'm in the store, I'll tell my son and my daughter, I'll say, Ayomide, what new fruit do you want to try today? And what new vegetable? And then he'll walk around the aisle and find something. And same with my daughter, Shay. And then we'll say, okay, let's go home and try to make a salad. The other day I made what I call the Eat the Rainbow salad, right? And it was all fruits except for one thing, but it was an unconventional blend if you were to think about it, but it worked well. It was cucumber, banana slices, grapes, strawberries, little mandarin oranges, and then I threw in some microgreens. That was the veggie in there.
Uh-huh.
A little bit of lime juice and then some date syrup and mixed it up. And
Oh wow.
they really enjoyed that, And
That's definitely a different combination.
yeah, but it works so well. And it's a fruit salad sans the
Right.
microgreens because cucumber is a fruit, right? But it worked well. And that's something I think if I had just said, eat these microgreens, they would have been like, I don't know.
Right.
Or that way, And then sometimes for me, honestly, Dr. Shayla, sometimes you just have to give in a little bit. I'm like, okay, right. But other times I might say, okay, it's compromising. Sometimes I know they're kids, but sometimes you got to compromise for your own sanity.
Oh
Okay,
yeah.
eat 2 of these. We'll use the microgreens. 2 of these microgreens. Just try 2.
Mhm.
Okay, all right.
Yeah.
Sometimes it's even getting creative with the presentation. So I will buy little heart-shaped and kind of star-shaped cookie cutters and like cut out shapes in some of the veggies and some of the fruits to get my daughters. Mainly my daughter, she's the pickiest. My son, he's like team 100% plants, yay, rah rah, right? But my daughter, she keeps things exciting for me. So I get creative, with
Yeah.
her. Really, yeah.
Yeah, for sure. With my same with my picky eater, he gets on these kicks. Well, he'll only want like noodles, and so what I love now, we can get a lot of the bean-based noodles, and so we'll buy the chickpea ones or the lentil ones, and he's getting that fiber and that protein and all of those nutrients. But for him, he's like, "Yep, I get to have my bowl of noodles," and so we're both happy.
Yeah, yeah.
Yeah.
And something else I thought of, again, this is with my youngest. If I give her corn on the cob, she's like, I don't want to eat corn. But if I get Trader Joe's has this frozen roasted corn, she will just eat that all up, right? Like, so it's just funny sometimes how just changing again the presentation. That was another example I thought of. Yeah.
Yeah, for sure. And then, summertime's coming up for those folks that are listening. Popsicles are another thing that we've done, and you can put some good stuff. You can still juice a lot of those fruits and vegetable blends together and put it in a popsicle mold. And that's also a good way for kids too.
Yeah, yeah, we've been having fun. So we've done that a lot. And then I'm not sure, Dr. Shayla, if you've seen this trend on social media, making your own vegan, like, the Magnum bars, the Magnum
Oh,
popsicle.
the ice cream?
Yeah,
Okay.
yeah, yeah. Covered with chocolate. So,
Yeah.
when I was vegetarian, I used to love those, right? I think they came out with the vegan one, I think, but I'm not sure. But anyway, there's just a trend making your own vegan one. So we've been making our own, and it's just, so much healthier. You can put in bananas, a little bit less saturated fat with the reduced fat coconut milk, and then the outer coating is just 72% dark chocolate chips. And, the kids are
Oh,
loving that. So again, kind of
yeah.
finding an alternative to what
Right.
the kids see in the store, making it healthier,
Mhm.
is always
Yeah,
great.
even, nice cream, what a lot of people
Yes.
talk about.
Yeah,
Yeah, with the
that's
frozen
a good one. That's
bananas.
a good
Yeah.
one. Yes, yes.
Yeah, yeah. And I don't know, have you seen the Ninja Creamini?
Oh, yeah,
Um,
I have.
Mhm.
Yeah,
Oh, yeah, you do. You've got a whole nice cream page
yeah,
there.
yeah,
Yep,
I
yep.
do.
So yeah, parents, you got to get that. Take a look at that nice cream recipe there. But yeah, but with the Ninja Creamini, that's something, my kids like to do that too at our house. And you can
Nice.
put a lot of those good ingredients in it and then blend it down and it makes it real smooth and creamy. I was surprised actually with how well it does of making it just really creamy.
I haven't tried. I've seen that, but I haven't tried. Okay, Ninja Creamina. I
Yeah.
have to check that out. Nice.
Mhm. Yeah, for sure. All right. So we're going to pivot just a little bit. And because I know this is, a subject that's passionate to the both of us, but tell us about those cultural or socioeconomic factors that sometimes, you've run into that may influence the adoption of plant-based ways of eating amongst families. And then how can people address some of those barriers?
Yeah, so sometimes people will often, not sometimes, oftentimes, I should say, people will say, oh, it's so expensive. And I pause and I say, processed plant-based eating is expensive, highly processed. So we all know, Dr. Shayla, we've seen these fast food vegan spots are popping up everywhere. I tell people every once in a while is okay, but eating that regularly is not really getting you the health gain that we all want to see, right? So I tell people ways to kind of address the cost is to try to eat things that are as close to the actual source as possible. So eating the fresh fruits as they are, buying in bulk, shopping in season, right? Telling people that it's okay to buy things frozen and even can look for the low sodium veggies and beans and then rinse them off when you get home. But I think when you get hung up in the processed foods, the processed cheeses, the processed vegan meats, buying that all the time, that does add up. That does get expensive.
Right.
That's the first thing I want to push back and I say to people, but yeah.
Yeah, I love those tips. And something else I will add too, because a lot of times people may be in areas where they don't have certain things available to them, but even buying in bulk now can even be done affordably online. Yeah, because I've purchased some, bulk items myself, and I was surprised how much cheaper even it was, to get it online versus going to the store and purchasing it. And so, just another tip for the audience out there is to even look for some of these bulk items like Dr. Margaret talked about, even online if in your grocery store. It seems to, be an inflated price, but
Right.
definitely sticking to those foods that are least processed is going to be the much more affordable way to go, like you mentioned, for sure.
Mhm.
Yeah. And then when it comes also to reducing health disparities, tell us just a bit about the way plant-based diets can even help with that, especially what we've been seeing, even in our children now who are developing some of these more what we were trained to think were adult-based conditions. So tell us, how that can even help them.
Yeah, so I'm a really big fan of the initiative put out through the American College of Lifestyle Medicine, which I know we're both certified in that. The HEAL initiative, so health equity achieved through lifestyle medicine. That's actually what got me really excited about lifestyle medicine because I see it as a way for families, patients, kids even to take charge of their health by taking the power back and being mindful of what's on their plate, right? So if we choose to eat a more plant-based diet, the data is there. A lot of people will say, oh, how do we know? If you look up the evidence, it shows that when you eat a plant-based diet, even if you want to do something more Mediterranean, there's still the benefits of being able to reverse and prevent diabetes, prevent um, heart disease, high blood pressure, high cholesterol. These are all things that are really prevalent in communities of color, right? So that's why I get so passionate about it, honestly, because I tie it back to the healthcare disparities that are still rampant. And at the rate things are looking, not going away soon until we really get more people to buy in that they need to not reach for the pills more so, but change what's on their plate. So yeah.
Right, exactly. Yep, because people are probably tired of hearing it if they listen to me, but food is medicine. It really is. And
Yeah.
we're both practicing physicians and we're really good at prescribing medicine, so we can certainly do that.
Mhm.
But you can also change the way that you eat or get more sleep or move more, go get some sunlight
Right,
and heal these conditions that way as well. So,
right.
yeah. All right. And then last thing we'll talk about is resources that you typically recommend for families and getting families really on board with getting more plants on their plates.
Yeah, so the first thing that comes to mind, especially if I'm talking to families, I'll be honest, black and brown families, there's a lot of resources. So Afro Vegan Society has so many great resources. They even have it's actually I have it to the left of me down there, but I don't want to get out of frame. They even have a free handout that they give out, the vegan African American vegan starter guide. And it goes over how much of certain nutrients you need and it has some great recipes. And I've had patients who aren't even thinking about being plant-based who take the pamphlet. Well, it's not even a pamphlet. It's a 20-page plus little book.
Ah,
It's a book from my office. And
I'm gonna have to go grab that myself. I
yeah,
hadn't
yeah,
heard of that one.
yeah. It's awesome. Actually, let me just get out of frame and show you
Yeah,
one.
go get it. Yeah.
But it's great. So
Okay.
I keep going out of frame. Sorry about that. But
Yeah, no. I can see it. Yep.
About
Yeah,
30
and I'll put a
pages.
link for that too. So to
Yeah.
our audience listening, I'll put a link for that too in the show notes because I'm gonna go grab it too.
Yeah, and so that's great. And then something called the Plant Protocol, that's run by Lisa Smith. She is super passionate about getting communities of color to take charge of health through eating healthy. And then she has a free online academy, great resources. And then if you have families, young kids, there's certain Instagram handles that I like to direct people to, just because in this day and age, a lot of people, they'll say, I don't have time to read, but they'll go and they'll consume
Social
really
media,
fast.
yeah.
So Plant-Based Juniors, 2 dietitians who focus on plant-based eating in kids. I was able to meet them recently at a conference, the Planet Expo conference, and talk with them. And they
Yeah,
know
I love the things they share. Yeah, I agree.
they're really, really, really good. So those resources come to mind as far as like easy consumable content. And there's so many great books too that are out there for families. There's the book Nourish by Brenda Davis. I believe she's a
Yeah.
dietitian, and then Dr. Pretty sure whose name escapes me right now, but just kind of how many of what you need and recipes and things like that. So practical tips, and then knowing the nutrition guidelines to follow when you're plant-based. So
Right.
yeah.
Yeah, for sure. And then, just adding too for communities of color, because we like our food to taste good. And I tell people, just because you're plant-based, that doesn't mean you gotta go be a rabbit and,
Right,
eat some wilted,
right,
lettuce.
right,
You can have some
right,
good food. So
right.
yeah, definitely, get that vegan guide that you mentioned. And then PCRM actually a couple of years ago came out with the Cooking with Soul. And I think it was from the Black cardiologist who helped them
Okay,
compile the book. And it's
okay.
got some really good recipes in it too. And so yeah, I'll share that one too for the audience. But yeah, your food doesn't have to be bland. Your children like good food that's flavorful too,
Mhm.
as well as you. And you can have plants that way.
Yes, yes. I tell people people who eat meat don't eat it raw. They got to season it. They got to let it
Right.
marinate, all the things, right? So same with plant-based eating. Spices are life. So yeah.
Exactly. All right, Dr. Margaret. Well, thank you so much for being on the show. Can you, before you go, just share with the audience how they can connect with you?
I think the best place to start that'll lead to everything I do is going to be my website. The book will be there as well. www.margaret, Margaret, Towolawi, Towolawimd, so medical doctor MD.com. That's my main website. Will lead you to the books, my practice if you're in Seattle area, and there's some other resources as well. So yeah,
Awesome. Awesome. All right. Well, thank you so much.
thank you for having me.
Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@𝐬𝐢𝐻WC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.𝐬𝐢𝐿coaching.com. The essence of health is in you.